Fatma.
Hi, Fatma. How are you?
I'm good. How are you?
I'm good. I'm happy to see you again, Fatma.
Thank you. I'm always happy to see you.
I know. So here you are. It's our final one.
Wow.
Fifth and last conversation about the health of pregnant women and young children.
It's been a long journey.
We have talked about so many things so far, haven't we?
Yes, we have. It's been a long journey.
Oh,
and
yes,
I
it
have
is.
learned a lot. And I only hope I can remember it all, if not most.
You will remember much of what we have talked about, Fatma.
Thank you.
And also, your skilled birth attendant and other healthcare providers are happy to answer questions you have anytime. And your antenatal care visits are a great time to talk about these things.
Okay, and I remember that today we are going to talk about ways that I can protect my child from illness, particularly infectious diseases, right?
Yes, Fatma, you're very right. As I told you the last time we met, the focus for our discussion today will be how to protect your child from the most common serious illness that threaten young children.
Okay.
You know, illnesses such as diarrhea, malaria,
Yes.
parasites, and pneumonia. These all results from infections that can be prevented.
Okay.
And why don't we start with diarrhea?
Okay, let's do that.
So first, we need to make sure we know exactly what diarrhea is.
Okay.
Diarrhea is 3 or more liquid stools in one day. So if a child has 1 or 2 liquid stools in a day, that's not diarrhea.
Okay.
The baby must have 3 or more liquid stools for it to be called diarrhea.
Oh, okay.
And diarrhea is most often caused by swallowing microbes that cause an infection in our intestines. The most common microbes that cause diarrhea are viruses, but it may also result from bacteria and parasites infections as well.
Okay.
When a person has diarrhea, the intestines are often unable to absorb all the nutrients or water from the foods and liquids we eat.
Okay.
Sometimes the diarrhea infection can even cause us to lose not just the fluids we drink, but also the water that is already in our body.
I understand.
And long-term diarrhea can contribute to malnutrition or stunting because of the poor absorption of nutrients by the body.
Okay.
But the more immediate and serious situation is the loss of body fluids that diarrhea causes.
Wow.
So let's talk a little bit more about the importance of body fluids.
Okay.
We need a certain amount of water in our body for it to function properly. We need to drink fluids daily to make sure our body gets enough water to make up for what is lost with sweating, breathing, urinating, and defecating.
Okay.
If our body loses more water than it takes in, we become dehydrated, which means there is not enough water in our body for it to work.
Okay.
Did you know that we lose body water through our skin all the time, even when we are not sweating?
Really? I didn't know that. Does dehydration happen to only adults and children or just children?
Anyone can become dehydrated if they are losing more water than they take in. Relying on thirst is not a good way to prevent dehydration. A better way to make sure you're drinking enough water or other fluid is to drink enough so your urine is light-colored or clear and you're urinating regularly, about 6 to 8 times per day. If you're not urinating regularly or your urine is dark yellow, you are likely dehydrated. And dehydration can make you feel weak, lightheaded, it can cause headaches and muscle cramps. And severe dehydration can even lead to loss of consciousness, or fits, and failure to make urine, and even death.
Oh, so I need to drink enough fluids daily to keep my urine light-colored, and I should at least urinate about 6 to 8 times a day.
Yes, Fatma, that's right.
Okay.
Adults should drink 2 to 3 liters of water or fluids every day, and even more if it is a hot day.
Okay.
If they are sweating or working, or if they are ill because we lose extra water in these situations, we need to drink more. Children are especially vulnerable to dehydration. Their small bodies become dehydrated more easily than adults, and it can quickly progress to the point it endangers their lives. So when a child has a fever, it can lose a lot of body water through its skin with sweating. If the baby is vomiting, it's losing water in the vomit. You can see now why I wanted to tell you about dehydration when we talk about diarrhea.
Yes, yes, I'm sure a child loses a lot of body water when it has diarrhea. To make the situation worse, a child often doesn't drink as much, you know.
That's true. A sick child doesn't drink as much.
Yes.
And Fatma, diarrhea, vomiting, and fever can all cause a child to lose dangerous amount of body water.
Dr. Guanto, how do I know if my child is dehydrated?
That's a good question, Fatma. A dehydrated child may have dry tongue and lips,
Okay.
and they have no tears when crying, sunken eyes and cheeks, have a sunken soft spot on the top of their head, and have no wet diapers for 3 hours.
Wow.
The skin can appear to be loose and not elastic.
Okay.
The child may also become fussy and irritable, or they may become sluggish, drowsy, or unconscious when dehydration becomes severe.
Wow.
And dehydration can happen so quick in children, so we need to be aware of this dangerous condition.
Okay.
Diarrhea is a very common cause of dehydration and death from dehydration. So we need to prevent dehydration, watch for it, and take the child to the healthcare facility if we see serious signs.
Okay.
Like if you find the baby to be quiet and undemanding, or the child has sunken eyes, dry lips and loose skin, weakness, fast heart rate, confusion,
Okay.
sluggishness. If the baby faints, or if the baby is having seizures. All these are indications that you need to be seen at a healthcare facility as soon as possible.
Oh my. And how do I prevent this diarrhea?
Diarrhea is commonly caused by microbes. So the best way to prevent it is to reduce the exposure of your baby to microbes by using safe water and hand washing.
Okay, that makes more sense now. If I keep my baby from coming into contact with microbes by washing its hands and mine regularly with running safe water and soap, it will less likely get diarrhea. And I should also wash cooking and eating utensils, fruits and vegetables with running safe water. And I should drink safe water so I do not get diarrhea. And because if I get diarrhea, I might transfer the infection to my child and my child could get diarrhea.
That's very right, Fatma.
Okay.
Remember that you can make water safe by boiling, chemical treatment with chlorine,
Okay.
filtering with a special filter, which you said is what you're using, right?
Yes, correct. That is what I'm using, doctor.
You can also use solar disinfection in a clear plastic bottle.
Okay, okay. I'm using the special filter now to make my water safe. But what else can I do to keep my baby safe from microbes that can cause diarrhea?
You can also wash your hands before and touching a sick person.
Yes.
Wash after using the latrine. Wash after changing a baby's diaper.
Okay.
And speaking of diapers, the baby's diapers should be properly disposed of. Fatma, some illnesses that commonly cause diarrhea can be prevented with vaccines, such as measles and rotavirus.
Okay.
You know about vaccine, don't you?
Of course, yes, I know, doctor. When a person receives a vaccination for a disease, the body develops the ability to protect itself from the illness, often the person's entire life. I will have my baby vaccinated for measles and rotavirus to protect it from diarrhea.
Good.
Right.
That's a good plan.
Okay.
We will give your baby vaccination for several common diseases that threaten children.
Okay.
In addition to measles, we will vaccinate for diseases like diphtheria, pertussis,
Yes.
tetanus, polio, and tuberculosis.
Okay.
We can give the first vaccination shortly after birth. We may add vaccination for other diseases like rotavirus to give your child additional protection during its life.
Okay.
The vaccine can be given with a shot,
Okay.
it can be drops in the mouth, or sometimes a pill.
Okay. And if my baby has 3 of more liquid stools per day, what should I do again?
You should immediately start oral rehydration therapy if your baby has diarrhea.
What is oral rehydration therapy?
That it is simply treatment to make sure your child drinks enough extra fluids and nutrients to replace the fluids lost with the diarrhea.
Okay.
Or oral rehydration therapy is also called ORT for short.
Okay.
It has 3 key parts: continuing and increasing breastfeeding and complementary feeding.
Okay.
Then you give oral rehydration salt and zinc.
Okay.
Let's talk a little more about each one of these.
Okay. Please.
So when a child has diarrhea, it is very important to continue breastfeeding. And breastfeeding with complementary feeding if the child is over 6 months old.
Okay.
In fact, you should not only continue these feedings, but increase them to give the child extra fluids.
Okay.
Do not decrease feedings. Oral rehydration salt solution is a mixture of safe water, sugar, and a little bit of salt.
Okay.
It is called ORIS for short. ORIS is available in packets to be mixed with safe water and given to your child if it develops diarrhea.
Okay.
If you don't have the oral rehydration salts in packets available, you can use 1 liter of safe water, add 6 leveled teaspoons of sugar, and 1/2 leveled teaspoon of salt.
Okay.
Be careful not to put in extra sugar or salt. Too much sugar can make the diarrhea worse, and too much salt can be harmful.
Okay.
This solution should be given frequently to a child with diarrhea, along with the breastfeeding and complementary feeding for 10 to 14 days to make sure it has enough fluids to prevent or correct dehydration.
Okay.
Then the last part of the oral rehydration therapy is a mineral called zinc. Zinc reduces how long the diarrhea lasts and make it less severe. A zinc tablet should be given to a child with diarrhea every day for 10 to 14 days to speed up the child's recovery.
Okay.
And then continue these therapies for 10 to 14 days, even if the diarrhea stops sooner, because the child will need the extra fluids for fully recover.
Okay, so I will continue and increase breastfeeding or breastfeed and complementary feeding and give a zinc capsule and oral rehydration salt mixed with safe water every day for 10 to 14 days to prevent my baby from becoming dehydrated. If my baby develops signs of severe dehydration, I will take it to the healthcare facilities as soon as possible.
That is good, Fatima, but let me ask you, so what are the signs of severe dehydration?
Okay. Quiet and undemanding child, sunken eyes, dry lips, loose skin, weakness, fast heart rate, confusion, sluggishness, fainting, or even seizures. Is that correct?
Yes, Fatima. That's very good you remembered that.
I'm glad I did.
You should also take your child to the hospital if it has severe abdominal pain, blood in the stool, or if you notice black tarry stools, or a high fever. These symptoms may indicate severe infections that need immediate treatment.
Severe abdominal pain, blood in the stool, and black tarry stool or high fever?
Yes. Black tarry stools are caused by bleeding in the intestines. When we talked about ways you can take care of yourself during your pregnancy, we talked about the threat of malaria and other parasites, particularly intestinal parasites. These infections are also threats to your baby. So let's talk about them again.
Okay. I remember that malaria is a parasite that kills many people. And malaria is spread when a particular type of mosquito bites a person who has malaria, who is infected with malaria,
Yeah.
and the parasite gets it into the mosquito. The parasite then grows in the mosquito and infects a healthy person when it bites them. This particular mosquito bites when it's dark. So wearing clothes that covers our skin in the evening is very important. It helps protect us from the mosquito, as do sprays and repellents.
Yes.
You said we can put any exposed skin, like cover them, right? But the best way to protect ourselves is use of a long-lasting insecticide-treated mosquito net on every bed in our home.
That's correct.
These nets prevent mosquitoes from biting us in the night, and they also keep mosquitoes that land on them. It kills them, right? The nets are completely safe, as you told me, and we really need to have them in the house. Correct?
Fatma, you are great.
Oh,
you are really great. And what else can we do to reduce the numbers of mosquitoes around our home?
I remember one task. We can use insecticide to spray on the walls of our homes and eliminate places where water can collect and sit. Like I told you, my oldest son will be doing that task. Like old cans and bottles can attract the mosquitoes, so we need to clear them around the house and fill mud puddles, fill them with soil, so we won't have places for the mosquitoes to breed.
That's very good. I hope your son is having fun doing that.
He sure is.
Children are very vulnerable to malaria and
Okay.
are much more likely to die from a malaria infection than an adult. Malaria can prevent the brain from developing and cause anemia and stunting. Children who are HIV positive or have other illnesses such as tuberculosis are especially threatened.
Yeah. So I should always use LLIN mosquito nets for my baby and everyone in the family. Is that correct?
That's very right.
Oh, okay.
And we can give you help on where to get LLIN and how to hang it. Be sure the net covers the bed completely and repair any tears in the net that may occur with use.
Okay.
Aside from prevention, early recognition of malaria is very important.
Okay.
Let me tell you what to watch for.
Okay. I'm listening, doctor.
All right, so you must watch for fever, chills,
Okay.
back and joint pain. These are frequent malaria symptoms. Children that have a fever should be evaluated for malaria by a healthcare provider so it can be stopped early.
Okay.
You will need to seek out this help.
Okay.
And there are symptoms that require to immediately go to a healthcare center. These danger signs of severe malaria can be things that such as change in consciousness, if the baby is having seizures,
Okay.
inability to drink, persistent vomiting,
Okay.
if you notice the child has high fever,
Okay.
or the baby has fast or difficult breathing.
Okay. So you said change in consciousness.
That's right.
Seizures, inability to drink, persistent vomiting, high fever, fast or difficult breathing. Doctor, I will definitely watch for this and take my child immediately to the healthcare center. If I see any of these signs, I don't want to take any chances. And seizures and fits are the shaking, right?
Yes.
Oh, okay.
Seizures occur when the brain is not working properly.
Okay.
If your child does have malaria, use the medications that are given to you and take care to follow all the instructions. Give a child recovering from malaria plenty of fluids, and as I always say, continue breastfeeding. That's important.
Okay.
Like we talked about when we talked about prevention of dehydration. You should also know some things about intestinal parasites so you can prevent or treat them.
Okay. I know I can prevent many parasite infections by using safe water and soap to wash hands, so the eggs don't get into our mouths and we could swallow them. Is that correct?
That's right.
Okay.
This is a common way for us to become infected.
Okay.
The eggs of some intestinal worms get in the soil, lakes, and streams when someone with the parasite does not use a latrine. The eggs in the feces dry out and can blow around or run into water sources. Then they get into our mouths in unsafe water or unwashed hands, fruits, or vegetables, and then we swallow them and become infected. And as you know, children love to play on the ground, so the eggs in the soil can get on their hands very easily and then end up in their mouth.
Okay.
You know how their hands are often in their mouth?
Yes.
So using safe water for cleaning food, washing dishes, drinking, and hand washing, including hands of children,
Yes.
can prevent the infections.
Okay.
But here are some other common ways that parasites infect our bodies. Some worm parasite can enter us if we eat undercooked or raw meat.
Really?
This is why we should thoroughly cook all meats.
Okay. Okay.
And these parasites causes schistosomiasis or bilharzia, lives in the water and can go right through our skin. This is why we and our children should avoid wading in streams or lakes.
Okay.
The parasites comes from the urine and feces of infected people and gets into the water when they don't use the latrines for urination and defecation.
Okay.
And the last one we will talk about is hookworms. I mentioned a little bit last time, but I
Yes,
want you
you
to know
did.
more about them.
Okay, please.
So these get into the soil when infected people do not use latrine for defecation. You see how bad this habit is? It is very bad.
Doctor.
And then the hookworms can penetrate our skin, and usually they do this through the feet of people who are walking barefooted.
Yeah, okay.
So wearing shoes prevents the hookworms from being able to get to the skin of our feet.
Okay.
So we should always wear shoes. Start putting shoes on your child as soon as it starts to walk to protect it from hookworms.
Oh my. And is there anything else we can do to protect from intestinal parasites?
Well, often we are infected with intestinal parasites and don't even know it.
Oh,
Intestinal parasites are very common.
okay.
For this reason, periodic deworming treatments are given to large groups of people by the government.
Okay.
Your healthcare provider may give you and your child deworming treatments,
Oh, okay.
just as they may decide to give you precautionary treatment for malaria. Your healthcare provider knows about the frequency of various diseases in your area, and the government provides guidelines on what is best for your health.
Okay.
You and your healthcare provider will talk about this during your visits.
Okay.
But the last topic I want you to know about is pneumonia. Do you know what it is? Any ideas?
If I'm not wrong, I think it's an infection in the lungs, right?
You're right, Fatma. You do know a lot of things.
Okay.
Yes, pneumonia is an infection of the lungs caused by microbes.
Okay.
I mentioned before that the ability of children's body to fight off disease is not fully developed. This means they can get pneumonia more easily than adults,
Okay.
and it can rapidly become severe, especially if they already have malnutrition, malaria, or other diseases. Pneumonia kills more children than all the deaths from AIDS, malaria, and measles combined. And this pneumonia is a type of acute respiratory infection.
What is an acute respiratory infection?
So an acute respiratory infection is often called an ARI for short.
Oh.
Acute means intense. So it is an infection of our airway that is intense.
Okay.
And a common acute respiratory infection is the upper respiratory infection, which we have all had. It's called common cold. You've heard about common cold.
Yes.
Well, we know well the symptoms of runny nose,
Yes.
nasal congestion, sore throat, sneezing, cough, and a mild fever. These symptoms involve the structure of the upper respiratory system. This is the part of our breathing system above the voice box in our neck. In other words, the nose, mouth, and throat.
Oh, okay.
This is why it is called an upper respiratory infection. Upper respiratory infections are usually caused by viruses and go away after a week or two.
I see. These upper respiratory infections are bothersome, but not generally is a real problem. Is that correct?
That's true. They are usually not a big problem, Fatma.
Okay.
But acute respiratory infection can also involve the lower part of the respiratory system. The main parts of the lower respiratory system are the larger windpipe, called the trachea, the small air tubes, called the bronchi, and the lungs, where many small pouches take the oxygen we breathe into our body and eliminate the carbon dioxide waste from the body. Infections of this part of the respiratory system are called lower respiratory infection.
Okay.
Now, lower respiratory infections that involve the bronchi are called bronchitis, and lower respiratory infection that involves the lungs are called pneumonia.
Okay, if I get this right, so you said that upper respiratory infections involve the nose, the mouth, and the throat.
That's right.
But the lower respiratory infections are in the trachea, bronchi, or the lungs.
Correct.
Lower respiratory infections are called bronchitis or pneumonia, depending if they are involved in the bronchi or the lungs. Is that correct?
Exactly, Fatma.
Okay.
The lungs are where oxygen gets into our body. So you can see why lower respiratory infections are much, much more serious.
Okay.
Lower respiratory infections are caused by viruses or bacteria and can be much more serious than the upper respiratory infections.
Okay.
A person with bronchitis has an infection of the airway tubes. So you can see what the person would cough up mucus, have some wheezing, shortness of breath, and chest pain from the infection and coughing.
Okay, so it sounds like it is in the chest when a person has this. Does it?
Yes,
Oh,
this
okay.
is generally not serious, but it has significant potential to become more serious if it involves the lungs
Okay.
and develop into a pneumonia. Pneumonia now is an infection of the lung tissue, and infection here prevents us from getting enough oxygen or getting rid of the carbon dioxide waste gas.
Okay.
A person with pneumonia may have a cough that is dry or brings up mucus, may have chest pain, fever, and trouble breathing.
Okay.
This trouble breathing may be breathing rapidly or sucking in of the lower neck and area below the ribs. So you see it here and below the ribs.
Okay.
And the lungs aren't working well, so the person isn't getting the air they need. This is why they are working harder to breathe.
Okay.
This is a life-threatening situation because they may tire out and quit breathing, or the infection may become severe. Most upper airway infections and bronchitis infections are caused by viruses, so antibiotics are of no help. But most pneumonias are caused by bacteria and can be treated with antibiotics. So you can see why you should immediately take a child to the healthcare facility if pneumonia is suspected.
But how can I tell the difference between pneumonia and the other respiratory infections?
Oh, there are danger signs for pneumonia that I will tell you about.
Okay.
So these danger signs for pneumonia, like rapid breathing.
Okay.
For a child 2 to 12 months old, this would be 50 or more breaths per minute.
Wow.
And then difficult breathing, chest indrawing, nasal flaring, cough for more than 2 weeks, unable to breastfeed or drink, and vomits frequently. The child may or may not have fever, but these are all danger signs that you should be aware of. Several of these danger signs indicate the child body is working very, very hard to breathe. This is bad because the child may not be able to keep up this effort and the baby will die. Chest indrawing is the suction action a child makes to breathe when they have pneumonia. The extra effort the child makes causes an indentation in the middle of the lower neck and at the bottom of the breastbone with each inhalation. Also, the lower ribs will be drawing in with each breath. Nasal flaring is another indication of labored breathing. It is when the nostril spreads wider and open more with each inhalation. Children with these danger signs must be taken immediately to the healthcare facility.
Okay, so if my child is having any difficulty in breathing, this means I should bring it immediately to the healthcare facility so that it can be evaluated and perhaps be treated with antibiotics, medications, and take other measures.
Yes, Fatma.
Okay.
And you must be aware that infections that start in the upper respiratory can also progress over time and become pneumonia. This is even more likely when they are also sick from malnutrition, HIV, or other diseases.
Okay.
You need to keep a close eye on the health of your child when they are ill to see if they are getting better or worse. And you have to seek care if they are getting worse.
I understand.
When your child has any respiratory infection, increase breastfeeding so it has enough nutrients and fluid to fight the illness.
Wow, okay.
If the child is over 6 months, also increase complementary feeding and give it extra fluids to replace the water lost with fever and illness.
Okay.
Your healthcare provider can give you recommendation on other medications to help with symptoms or antibiotics if they're needed.
Okay.
But there are things you can do to reduce the risk of your child getting upper and lower respiratory infections.
I bet 2 of them are using safe water with soap and hand washing frequently with safe water, right?
Well, you know me now. Yes, indeed. That's very right.
Okay.
The microbes that cause these diseases spread very easily.
Okay.
They can spread through the air with coughing, breathing, or sneezing. So teach your child to sneeze into its elbow. You do that
Okay.
instead of its hands. That way the microbes won't get on the hands. When the microbes get on the hands, they spread to other people by touching each other or objects such as toys or eating utensils. Then the microbes get into our bodies when our hands with the microbes on them touch our eyes, nose, or mouth.
Okay.
And you should also know smoking is horrible for our bodies. So preventing any smoking around children greatly lowers the risk of respiratory infections.
Okay.
Nobody should smoke because it is so dangerous. Did you know that half of all smokers die from it?
Really?
But the other thing that you should also be aware of is indoor cooking fires. They can also contribute to respiratory illness by damaging the lungs.
Oh.
Try to use cooking fires outside your home or at least away from your child.
Okay. Okay.
I mentioned that many respiratory infections are caused by viruses.
Yes, you did.
You know that antibiotics don't help with virus infections.
They don't?
No. But some virus infections are prevented by vaccination.
Okay.
This is why you should have your child immunized.
Oh.
Measles, for example, can cause pneumonia.
Okay.
And now that children are routinely vaccinated for measles, countless lives have been saved.
Oh my God, there are many vaccinations that my baby will need to keep it safe and healthy. But how do I keep track of them?
Don't worry about that. Your healthcare provider will tell you what vaccination will help your baby based on its age and the medical situation of your baby and health considerations of the community around you.
Okay.
You will be given a card.
Okay.
So
That's a relief.
So this card will have the dates and vaccines written on it that your child received.
Okay.
Keep this in a safe place and bring it with you to your healthcare every time you come in for a visit.
Okay. So again, safe water and hand washing, the first thing to protect my child, and then protect it from smoking, secondhand smoking as well, and cooking fires. And vaccination, all are the things that I can do to help protect my child. I want to prevent illness, doctor, so my child is not at any risk whatsoever. And I thank you very much for all this information. It was a very educational trip. I got to understand how I can take care of my baby, take care of myself, and prevent us from getting any kind of illness. And for this, I'm very grateful. I understand we will have a good life.
Thank you so much. Remember, prevention is better than cure.
I will keep that in mind.
But I'm very glad you came for all the 5 visits,
Thank you.
Fatma. I will see you at your prenatal care and then postnatal care visits.
Okay.
And I'm looking forward to meeting
see
that
the
baby
little
of
one.
yours.
Yes, yes. Thank you so much, Doctor.
You're
It was
welcome,
nice
Fatma.
meeting you again.
You too.
Bye-bye.
I will see you.